thriving NHS depends on a motivated workforce. The NHS is the UK's largest employer with over 1.4 million staff across a wide range of clinical and non-clinical roles. Each year, the NHS recruits thousands of new professionals to meet growing demand, with over 100,000 vacancies reported in 2023 alone. Recruitment efforts focus on addressing workforce shortages, expanding apprenticeship pathways, and attracting talent across nursing, allied health, administration, and digital services to ensure high-quality patient care nationwide. However, NHS recruitment faces significant challenges like staff shortages, high turnover, an ageing workforce, limited training capacity, and regional disparities, challenged further by bureaucratic delays and reliance on international hires amid global healthcare competition. First up, we have Mike Tresise. I'll get that right. Service Development Director, North London Partners at Shared Service. Welcome, Mike.
Thank you.
And we have Jamie Coates, Head of People, Resourcing and Retention, Princess Alexandra Hospital, NHS Trust. Welcome, Jamie.
Thank you.
And we have Lucy Murcott, Midwife and Black Country, LMNS Workforce Lead, Black Country, LMNS. Welcome, Lucy.
Thank you. Nice to be here.
We have got a bit of a discussion here today. Recruitment, it seems like there are going to be lots of challenges, and I really want us to really go there. We're going to talk about the goods, the bads, and all that's in between as well. But Mike, I'm going to start with you, if I may. What impact will the latest NHS recruitment freeze have?
Well, it's first of all, you've got to think of the NHS. It looks like a whale, but it's a school of fish. So everywhere is different.
Yeah.
And you have to think from a recruitment perspective, all the local nuances, pressures, and what's going on, right down to team level. It's really difficult to try and get a handle and understand. It truly is a kind of massive system rather than one separate organisation employing nearly 1.5 million people. And the current financial constraints are popping up in all sorts of different places. So I was North London Partner Shared Services, for those that don't know, is a partnership of 10 trusts across North Central London. Although we're hosted by the Royal Free Hospital, the trusts include UCLH, Whittington, Tavistock, and the ICB itself, and as well as the Royal Free. We recruit about 22,000 people through the books every year. And the pressures of that finance are popping up in all sorts of different ways. I'm quite sure that Jamie and Princess Alexandra will have different experiences as well as Lucy will. But we had a chief people officer meeting last week, a regular monthly board meeting, and almost the entire meeting was taken up on how they're going to, how chief people officers and people are going to reduce the amount of recruitment across the board. When I was preparing for this meeting, it was, it's mainly admin and clerical. No, it isn't. These people are thinking, my goodness me, how can we save money everywhere? As I understand it, the Royal Free actually shut a ward 2 weeks ago to try and save money. I mean, the financial pressures on the NHS are absolutely immense. And board meetings are taking place all over the shop. And yet there is still a huge amount of recruitment going on. And that just reflects the fact that recruitment is and I can see all pen waving there.
Yeah.
But recruitment, a lot of recruitment in the NHS is actually internal moves and career progression. It's not people coming from outside.
Okay.
So, these pressures are going to pop up all over the place.
That's really interesting you say that, because it seems like when you hear these, whether it's, the media will jump on that, what you just said, Mike, the NHS are recruiting, but they're not. And they've also got the freeze. So, we as outsiders will think, well, that doesn't make any sense. And so you're having to battle sort of all that while trying to maintain optimizing patient care. So Jamie, any ideas on that?
Sorry, do you mean any ideas on
how do we go about, so if you've got a recruitment freeze, but you're still trying to recruit internally and trying to optimize patient care. So what you've been involved with, how do you juggle that? What's the best approach to do that?
Gosh, it's difficult, isn't it? It's a very difficult landscape we're in currently, with roles, especially within our organisation, but also ICBs and kind of other organisations in our patch. How do we manage it?
Is it? Do you think? I mean, Mike just had a really good way of putting it. And he said we look at the NHS as this big whale, and I've never heard of it like that. But is it better to see each practice and each trust as a school of fish, and to sort of take control that way? Would that be a better way of trying to keep on track with recruitment and retaining staff as well? That sort of approach?
Yes, and I guess where we're in a position at the moment is obviously it's not just happening to us. So everyone has been told to reduce in areas, and actually it's not. And we're also being to look at, if the ICB are reducing, then is there any way that they can transfer to our organisations and things like that? So it's difficult situations that we're in at the minute.
Is it just juggling everything and just do you ever feel in control, Jamie? I mean that in the loveliest way. You know what I mean? Yeah. And now does it feel like it's going to be like, that sort of swan, sort of analogy, like, the feet going under, just trying to maintain? Is that what it's going to be like?
And I think it's because we've obviously it's come down from the national team, and I think all organisations are looking at what's been said nationally and looking how that affects their own organisation. So we're still in that, especially within our organisation, we're still in that area of what do we do with what we've been asked to do.
Okay. Still processing, Jamie. Still processing.
Yes. That's the word.
Well, NHS England have appointed. I think they've appointed KPMG, haven't they, to work with CIPD to develop future NHS HR operating models. We've talked lots about partnerships and shared services. And do you think this is the way forward when it comes to recruitment, Mike?
Well, naturally, I would. But I think, again, it comes down to the fact that there are, when you look at the way recruitment services are delivered, there are underlying transactional activities and technology. We've heard from some of the technology providers earlier today. And that technology supports the processing. And that's where people should be, in my opinion, collaborating and standardizing their approach. But you've also got to make sure that it's suitable and works at a very local area. So you can't, it's not one size fits all. You've got to have that kind of underlying transactional capability, but allow individual hiring managers and individual wards. I mean, I'm sure Lucy can explain, some of the challenges around midwifery and so on. But, it's individual staff groups and individual pressures. It comes down to the stuff that was talked earlier about learning and development of staff. Where those pressures are, that means that individual areas can then seek to recruit to fill vacancies or reduce pressures locally, but then perhaps utilize a underlying transactional platform. And that's where KPMG have been brought in to say how best can regions collaborate to put that transactional stuff in place, so people like Jamie and Lucy can just initiate the recruitment process and just allow it to work.
Lucy.
I was going to say, I can probably come in here because actually that's something we've started probably 18 months, 2 years ago across the Black Country. We have 4 NHS trusts that we work with. And obviously, nationally, there is the shortage of, midwives, getting them into post. So actually, we combined recruitment events. So rather than 4 separate trusts fishing from the same pool and doing the same work separately, it is bringing that into one forum. So having one NHS jobs advert rather than the 4, having one event where attendees could come and have that marketplace feel and find out a little bit more about individual organisations, but also the ethos of what we do at system level as well, and how the hospitals all work together. We're a very small footprint geographically, but very large population wise. And actually we've had some really good outcomes. And the most recent event that we did this time last year, we actually then looked at the destination for our student candidates, our pre-reg candidates, and which trust they wanted to work off in order of preference. And actually, everyone that attended that was appointable got a job offer. It may not have been at their first choice, but actually it was a fair process. And again, it saved students themselves having to attend 4 different interviews, and it streamlined a lot of the processes, because then behind the scenes, we're able to stream all of the applications then into hiring organisation without candidates having to redo forms. So it's a really interesting model, and it definitely evolved over the 2 years that we ran them. But actually, there was lots of benefits to that approach, both from an organisational perspective and from the satisfaction of attendees as well. So really good results. But like we mentioned previously, the financial challenges are really, really significant this year, and especially for our nurse and midwifery newly qualifieds as well, where we're seeing the volume of opportunities not being, equitable to previous years.
It's strange, isn't it? It's that, has the NHS always not been able to manage that, the increasing demand for healthcare services and available funds and recruitment? It seems that this comes up every single time. Has it just been it feels like it's always been going on. Yeah, Mike. Sorry.
Without giving you a history lesson, in 1947, they had to go out overseas to start recruiting people. In 1965, I think it was, Harold Wilson's government actually presented a paper to Parliament asking the question about recruitment and retention in the National Health Service of registered nurses. I mean, it's perennial, but actually it's not here. It's also across the planet. And if you read the book published by Mark, I can't remember his name, the KPMG guy, brilliant chap. There is a global workforce crisis in health. I think the NHS, the United States, is short of 1 million nurses at the moment.
Whoa.
I mean, it's just terrible everywhere.
Is that a generational thing? And I'll bring you all on there. Is this I want to say Gen Z. So Gen Z. We have actually had a comment here from Matthew, and he's like, "Can we improve our recruitment practices for Gen Z?" And because is it not glamorous enough? Is it what is it? Do we have to sort of? I don't know.
Do we think it's multifaceted? So obviously, my background is going to be primarily nursing and midwifery. And actually, we have got more numbers of students now coming through on pre-reg placements. There's been a lot of work and a lot of investment actually about increasing the numbers. I think I was a cohort of 10, 20 years ago, but now we're looking at cohorts of 90, which for midwifery is actually, that's quite a number from one provider, for example. So actually, there has been some investment there. Nursing's a little bit different in terms of they always have larger numbers. But like you say, are both professions still as attractive to this, new workforce? I'm not sure. I do think there's something to be said about how we make the roles, like you say, attractive and appealing. And we have to do that in a much more creative way. And I don't know what the answer is there. I just know that perhaps it doesn't appeal. And part of that is, how well our roles talked about within, social media, the culture that we find ourselves in now, in terms of the accessibility of information. Everything has to be out there. Is it out there in a meaningful format? I think there's probably some work to do there.
The bad stories always get out, don't they, Lucy? You hear the negatives more than the positives. The positives aren't shouted about. It's always the bad news story sort of gets the most attention.
Sometimes holds us to account as well. So actually, it's a careful balancing act, but it is the way in which, as healthcare professionals, do we present our profession? The way I present my profession is probably very different and probably not very appealing to somebody new to the job market or considering a future career. But that means I need to change my approach and the way in which I provide information.
Yeah. Jamie, I'm just coming to you. Is that something that you feel strongly about as well?
Yeah, I think we're in this completely in a different space now, specifically with nursing, where we the last couple of years we had lots of funding to recruit internationally, and actually, like Lucy said, the numbers are coming through now, but we don't have the vacancies that we used to have, and I think that's a bit of a bit of what's going on now. But what we're doing within our organisation is, and it's about that publicity of roles within healthcare. But we've really partnered with our local college, and we're looking to kind of build a health and science academy. So they've built one for Stansted Airport. So we're Harlow, based in West Essex, and they've got an airport academy basically on the Stansted Airport site. So you see the planes flying off, sort of thing. And they partner with employers on within Stansted Airport, so that the students that go through that, they're basically recruited into the airport. So we're looking to replicate that model, but within health and care within West Essex. I mean, our college is fantastic. I mean, they've got a ward. They use the same beds that we use in our hospital. They've got they call it Margaret's Flat, which is essentially Margaret was a nurse and her family donated kind of what was in her flat, so the students can walk around and they're in the environment of what they potentially might be working going forward. So that's how we're trying to tackle that bit with the kind of future generation of
they've done that
students and learners.
in engineering as well. They've done it. Silverstone they've got a college on campus, Silverstone campus, and it does make a difference. If you're in that environment, you're seeing and breathing it. It does make you more motivated, I guess, more inspired. And so I guess, what would you call it, like the hubs? I think, sort of recruitment hubs, training hubs. I mean, we've had our previous discussions, we're talking about the partnerships with universities and colleges, but making them actually on, would you say, like on a hospital in the NHS, would that be something that you'd be?
Again, that's the full circle thing, isn't it? Because you have to have School of Health. School of Health would be embedded in most of your NHS trusts that would do cadet programs for nursing and would really be a point of focus. I think what's interesting now is it's having that, but actually in local communities. So your college is probably somewhere people are a lot more familiar with, sometimes in their local NHS trust, and the offer that we can make there can be really bespoke and linking in with local authority as well, to signpost people onto considering a role in the NHS. Come on this 2-week course, and then we will support you to get an interview in your chosen area without, like I say, having those processes like NHS jobs that can be quite overwhelming to an applicant.
And in this way, I'm not saying that we shouldn't recruit overseas recruits from sort of abroad, but if we do this and we get this circle going, Lucy, like you say, and this is Mike and Jamie as well, that's going to surely reduce the need for recruiting abroad. So if that should be surely it's circular again, even more of a reason why we should be doing this, Mike.
Yes, trying to kickstart that virtuous circle, I think, but it's really difficult. It takes a long time. You have to come back to some of the early conversations about training. But also,
I'm very impatient, Mike. I'm very impatient. I want things done now.
but you kind of have to start early and have that culture. And it's the interesting question, wasn't it, about improving recruitment practices for Gen Z? It's really tough because the messages around the National Health Service are pretty negative. All the NHS is failing, all this kind of stuff. It doesn't help, when youngsters read that on their social media and think, well, I'm not going to apply for a job there.
I know. A bit of pressure to try and fix it. Exactly. It's not what they're about.
When you talk to the people who actually come into the health service, they're so passionate about it. And, to hear about the colleges and the stuff that Lucy and Jamie are doing, I mean, because I sit broadly across a region, and supporting recruitment regionally, we don't necessarily see some of the activities that are going on at a local level, and that's really where it's important. I'd also just want to touch on demographics. Being in London, the range of demographics is really important. So, for instance, we work with the Mayor of London using the 10,000 Black Intern Scheme. So we have a large number of people from that coming in, or a few, but we're hoping for more to come into the area using that. So it's about reaching out to communities, because analysis shows that quite often when you go into an NHS provider organisation, the demographics of the people who are delivering the healthcare doesn't reflect the local demographics of the people who live there, or the demographics of the patients who are being cared for. And there's a lot of evidence to show that better patient outcomes come from care that's delivered by people who have the same demographic characteristics as the people who are, the patients are the same as the people who are delivering the care. So it's reaching out into those communities. We have communities in North Central London where they're practically not represented at all in the staff groups. And it's so it's about, there's an awful lot, as Lucy said. I think it's extremely complicated.
It is. I don't want it to be complicated. I want it to be nice and simple, but unfortunately it is. Jamie, is this something that you're aware of, the diversity of recruitment as well?
Yes. We are trying. We're doing a lot within that space. We've got action plans based on kind of the toolkits that came out from the central team, as well as some other areas. We're developing programs again with our local college on how do we bring diversity back in, or how do we bring diversity into our organisation. So last year we launched a kind of supported internship as well, but also looking at what other programs can we help economically inactive people from our community into work with us, and that's a big focus for us in our organisation.
Yeah, I've just got some questions. I'm just trying to filter through. So bear with me, so you might be able to sort of help out. So we've got a comment really from Jonathan Cross says, it's a selling the role and opportunities the most effective way to the right audience and in the best way. So Lucy is so right. So Lucy, Jonathan's a big fan. So Lena has put, when newly qualified nurses are not having jobs, then we need to do more to recruit the ones we have. Fair pay is still an issue, and the conditions of work are a concern. Global workforce crisis, so the NHS must be competitive. What do you think about the concept of over-recruited? Does that make any sense to anyone who can answer?
Well, the trouble is, I mean, there have been times when the NHS has gone out and you sort of open up the funding and allowed, recruitment to go along without much constraint, if I can put it that way, with a real focus on delivering better patient care and reducing waiting lists and so on and so on and so on. Since 2008, there's no money, and when you look at the projections, the amount of patient care or demand for patient care is just simply going to relentlessly grow. But right now, the country just doesn't have money for anything, for social care, for the NHS, for the Ministry of Defence. It's a real challenge. And one of the things we collectively have to do in the NHS is find ways of being more productive and efficient in using the skills and experience we've got of people and enabling them to focus much more on doing the day-to-day patient care and less around all of the admin stuff that takes place.
That's a really good point. So you sort of, it's not retraining, is it? Does it mean like recalibrating? Is that the right word I want to use for the roles that we're in now? So like I say, making more efficient, I don't know. It's something I feel like that we're all going to pull it in together somehow, but just really effectively using what skills, just maybe a bit of a recalibration. That's the only word that I can think of.
And there's another challenge with around this recruitment and retention problem is that the age profile of the workforce is changing all the time. And it's come back to some of the comments. We really do need to be recruiting younger people in and giving the opportunity to gain experience. And it comes back to the points earlier in the day around training and the digital. I love the digital conversation. I thought it was terrific. The trouble is, have you ever applied for a job at the NHS? It's an absolute nightmare. You'd give up, especially if you're under the age of 30.
I think this is it, and this is again. It's just we're trying to upskill, we're trying to recruit, we're trying to retain, we're trying to, get funding as well. Are there days where you just go, oh my goodness, like how are we going to do this? Or is it just the fact that you can see the light at the end of the tunnel? You can see that there is hope there, Lucy.
It's really challenging at the moment. for many different reasons. I think it's an interesting point when you say about mapping to see where there could be potential efficiencies.
Yeah.
Actually, I think it goes a little bit further. I think it's about understanding different roles, different care pathways, and the different needs. We are a very different health population than we were 10 years ago.
Yes.
If you think about the pressures on our front door services, you know, people coming through the door would never historically have got to that front door service in an acute because they, you know, there was a process or there was something else locally, or actually this is just an evolution of health. So I think, I don't know if the word efficiencies are right. I think it's about mapping your population and your services and seeing how things run a little bit differently. And then you have to look at how and if there is the opportunity to recruit, and actually what are the staff in post already doing, what is their experience, what culture do they work in right now, because culture in the NHS is a massive thing, isn't it, in terms of, you know, we hear almost daily about people being treated really, really poorly and unfairly in the NHS. So what is being done there to improve those conditions? And there is a lot of work being done, you know, with unions, with, you know, HR departments, with employee assistance programs. And this is it's a long piece of work, but what tangibles? This is the question we find ourselves asking, isn't it? What's tangibly changing? And what's the opportunity in that, and where do we need to go further? So not an answer, just ideas.
I've written culture down actually before you said culture, so I've written it down again. But it's a culture of the workforce. I mentioned in my introduction, we want the NHS to be somewhere that is I want to work for the NHS. It's something we want people to be staying this, but then there seems to be, like you're saying, if I try to apply for a job, there'll just be a barrier, you know, or just, you know, you end up giving up, or you hear a bad story or hear like this. So we've only got a couple of minutes left, but if I sort of go around the panel and say, right, okay, if I could give you a magic wand, a hypothetical magic wand, and, you know, if you know, I know these are still just ideas at the moment, but what would you say, like, to really just say those that are listening, what you can do, what they can do, and how we can change this? We don't want to see it as a negative. We want to see this as a positive. So I always like to end on a positive. What would you say? Lucy, if I go to you first.
Be part of the conversation. So you have to be part of the conversation, and you have to be honest and encourage people to be honest. It's all about psychological safety, isn't it? If you can create that, you will get the answers to what you need. You will have the question, you will have the power to put the questions that need answering out there.
Definitely. And Jamie, how about yourself?
So I guess looking at how we bring people in, so that would be a key one for me, and that's something that we're focusing on at VAH is around, you know, we know that the application process can be a barrier for people. People don't know what a supported statement is sometimes if you're outside of the NHS. So what do you put in there? So you know, the shift move to more skills-based and values-based hiring, as opposed to, you know, write me 2,500 words on you know, why you should have the job, sort of thing.
Like it. And Mike, finally from you.
Collaborate.
Yeah.
The NHS is extremely good at coming up. I'm sure Jamie and Lucy have got lots of really good local examples, but you need to collaborate and share them to scale up.
I thought you were going to go on then, and Mike.
No, I'm looking at the clock.
I know, but this is so true. We've talked about collaboration over and over again today, and so if anyone is listening and you've got ideas, you've got case studies or anything, this is what these online conferences are about. We want to hear your thoughts, what the good things, the bad things. I always say the good and the bad and all that's in between, because this is how we make progress. This is how we can really bring a brighter future for the NHS. So thank you so much, Mike, Lucy and Jamie. It's been really interesting, and I know it's not I've said this all day today. Hats off to you. Keep doing the amazing work that you're doing, and I know we are going to make sure that we get some brilliant recruits for the NHS. I know it, thanks to you guys.